Hey everybody, so I'm Gohl. I'm the guy who created manual ligament therapy, and I'm going to tell you about how I invented manual ligament therapy and also how it pertains to chronic pain syndromes in general. All right, so what happened back in 2004, I was working at a physical therapy clinic, and what I noticed, which became incredibly frustrating, is that it was taking a long time for patients to rehabilitate while receiving multiple modalities: physical therapy, occupational therapy, chiropractic adjustments, medical massage like I was giving them, injections, Vicodin, everything. And I noticed I was taking patients 3, 4, 5, 6 months, even up to a year in some cases, to recover from things that I didn't really think should take that long. And I was very disgruntled to see these people having to go through this emotional roller coaster, up and down, one day good, one day bad. And it drove me nuts because I didn't think that there's any reason in the world people should suffer so much. So what I decided to do was find another way to approach injuries and pain. And what I did is I asked a good friend of mine, Dr. John Mishko, who's a chiropractor out in Tacoma, Washington, where I'm from. And I said, John, what do you guys as chiropractors do in regards to muscle spasm that helps you break that spasm? Chiropractors are kind of known for doing things fast and getting it done, all right? So I figured if anything, he would be able to give me a good shortcut. And he told me about the Logan Basic technique. And Logan Basic technique was developed by Dr. Logan in the early 1920s. This guy is one of the two founding fathers of modern chiropractic. And for some reason, Dr. Logan was really obsessed with the sacrum. Here's a picture of the Logan Basic being applied. And what happens is that gentle pressure is applied to the base of the sacrum, close to where it's approximated with the femur, with the hip, okay? And what ends up happening is that through this gentle pressure on what's called the sacrotuberous ligament, there's a strong relaxation effect that occurs in the spinal muscles up and down the vertebrae. And it's still used today, okay? This is something that chiropractors use quite a bit. They learn it in school. They'll use it especially on scoliosis patients. And when Dr. Mishko had shown me this technique, I was completely blown away by how well it worked. And I was also at the same time very frustrated that, well, why aren't we taught this in school? Why aren't PTs taught this in school? Why aren't massage therapists taught this? It works so well. So the two biggest questions I had was, one, why does this work? Because ligaments are not supposed to have any kind of neurological component to them. They're just supposed to be dense connective tissue that holds together your joints, okay? He said, I don't know. He said Dr. Logan hypothesized that maybe it was because there was some smooth muscle cells from some connecting muscles that were in the ligament itself, and there was some kind of neurological loop that happened. And then I asked him, okay, well, what do other ligaments do? And he said, I don't know. Why don't you go figure that out? So that's what I started doing. So simple facts about ligaments, as I stated, they're really just known to be, throughout medical history, as dense connective tissue. They hold your bones together, and they really don't have very good blood supply at all. Now, when you get beyond that into what we've learned over the last 30 years, ligaments are actually extremely neurologically sensitive, okay? What happens is that in a lot of cases, they're more sensitive than skin is when it comes to feeling stretch and pressure and even pain in a lot of cases. They found ligaments can be up to 6 times more sensitive than skin, okay? From here, what they do is they take this information about movement and stress, including inertia, gravity, emotional stress, you name it, and it takes that information, combines it with other information from your skin and from your muscles and tendons, and it sends it to the central nervous system. And from that point, your central nervous system figures out what muscles, what tissues need to contract and decontract, and basically keep you moving, keep you upright, all that good stuff. They also are very, very tuned into the autonomic nervous system, and that really dictates our general feeling of being anxious, or the fight or flight sympathetic state, and also the parasympathetic or more relaxed state. Ligaments are directly connected into that. And here's what happens. Why do things go wrong with ligaments? Why are they so ingrained into the whole chronic pain and acute pain cycles? What occurs is actually a cycle of injury. And the first thing that happens is there's an injury. It could be a chronic injury or an acute injury, okay? When the ligaments, they sense these injuries, when they sense this damage, they start sending signals to the nervous system to say, hey, there's something wrong. We need you to start tightening up different structures like connective tissues, or fascia, as it's called. and also muscles in the body. That's why when you sprain your ankle, you get a lot of inflammation and a lot of tightness around that ankle. That's your ligament saying, there's something wrong here, we need to tighten this up. So everything basically joins together to provide stability to that injured area. Now what happens, though, is unfortunately because ligaments have such poor blood supply, they don't heal like normal tissues. They will stay in a state of injury for months, years even, depending on the overall health of the person, okay? While they're in this injured state, they continue to send information to the nervous system saying there's something wrong. Even while all the other tissues in that area have healed up, everything's good to go, the ligaments are still in this state of trauma. Now from that what happens is basically a chronic kind of patterning of the body where as the ligaments continue to tell the nervous system there's something wrong, even when there's not anymore, even when the injury is very old, the body has to start changing around this injury site. And that means the way you walk, the way you sit, everything. And I'll get into more of this as we talk about posture a little bit later in the presentation. All right, so because they keep thinking about injury, they perpetuate this sympathetic nervous system response, this fight or flight, this anxious feeling that we tend to feel when we're stressed out or injured, okay? They just continue to keep that going. They continue to keep the body twisting up and trying to support the damage in the body. And as I stated, we end up getting a lot of chronic pain just based on that. So when it comes to MLT, it's a very simple and gentle procedure we do. And really, because ligaments are so sensitive to movements and to pressure and they're so instrumental in directing the nervous system, all we do really is we apply very gentle pressure to certain ligaments in the body. And throughout investigating manual ligament therapy while I was developing it, I found specific referral patterns of what ligaments influence what muscles, all right? So all we do really is to affect a certain muscle or part of the body, we position the limb accordingly. We put gentle pressure on the ligament, and what will happen is that the person receiving the therapy will fire another muscle, what we call an antagonistic or an oppositional force muscle for just a few seconds, and what we get is essentially a reset in the system, a reset in the nervous system. For those of you who are actually watching the presentation here in the video version, here's a few pictures of it being done. As you can see, it looks almost like nothing. It looks like I'm just holding the arm or the leg in a certain position. I'm putting a little pressure here and there. It really doesn't look like anything, but the effects are extremely profound as to how it responds or how the nervous system responds to it. The ligament pressure is only about 2 or 3 pounds per square inch. It's really almost like feeling nothing, and that's one of the reasons it works so well on people who suffer chronic pain syndromes such as RSD and CRPS. It does not require a lot of pressure. Okay, so the end result is really you get a very nice overall nervous system response where we bring the person into more of a parasympathetic or relaxed state, take them out of the freaked out, anxious state and drop them down a few notches. And when this occurs, the muscles and connective tissues throughout the body and also in the localized area that you treated with MLT, everything tends to get soft. Everything starts to get a normal length to it. And because of that, we get a nice reduction in especially pain symptoms. It's like hitting a big reset button in the nervous system. It's as if, for those of you guys who use Windows, on the computer, whenever you get that program not responding thing and you hit Control-Alt-Delete and it brings up that little window and you're able to reset that program, essentially this is like what we're doing. Okay, we're taking that little program that's been causing this bad loop of information to go through the nervous system. We're saying reset. We don't need to be thinking that way anymore. Let's bring it back to where you should be. Let's bring it back to a base level, a relaxed state. So let's talk about chronic pain in general with the musculoskeletal system, okay? We are really overloaded on pain. The whole nation, the whole world, especially here in the US. 100 million of us, that's a third of us suffer from chronic pain, all right? There's millions of people who are treated with meds and with surgery, and really there's not a whole lot of positive effects that comes out of that. We lose billions and billions. In fact, up to $635 billion are lost each year in this segment of society that can no longer produce and contribute to the country, to their own lives, et cetera. They can't work. They're using a lot of the medical resources, a lot of the things that really should not have to be dedicated to these folks, because there is an answer. There is a way to get out of this pain. It does not require them to sit in a chair all day suffering and to taking meds and really just shutting down in life. And really, let's get down to what causes a lot of this. And it's something we don't even think about. It's something that's around us constantly, but most of us, because it's invisible, don't even stop to consider it, and that's gravity. Gravity is the strongest force in the universe, all right? I'm not a physics major or anything like that, but obviously, from my experience over the last 20 years working with patients, I can see what it does to people on a daily basis, and it is a key factor in why pain exists in the body. And the reality of posture. Let's talk about posture. Okay, we're going to talk about posture and how gravity affects it, and how gravity and posture affect what happens on the inside of our bodies, how it affects pain, how it increases pain, how it can decrease pain if it's dealt with properly within the body. What happens is that since we're babies, from the time we start to manipulate objects in front of us, our posture starts to change. Okay, we see something in front of us, our eyes go towards it, our body goes towards it, and next thing you know, through the rest of our lives, everything is done in front of us. Our heads go down, our heads go forward, our body follows it. Our whole life is spent in front of us, okay? Driving, cooking, computer work, the root of all evil, all those things contribute to bad posture. Now, what happens with posture is, in gravity in specific, is that once your head gets a certain point in front of your body, the weight of your head doubles, triples, even quadruples, as in regards to how your body feels the weight of your head. For every inch that your head is forward of a good position, which is really directly over your shoulders, and if you draw a line straight down to the body, the weight of the head, the torso, the hips, everything should be balanced in your heels. All right? Now, if your head goes forward, your body tends to follow. Next thing you know, that 10-pound head turns into a 20-pound bowling ball. By the time your head is looking straight down at a cell phone or a tablet or something like that, the equivalent weight's about 80 pounds. All right? So imagine what that's doing to every tissue in your body, especially the ones on your back, the ones that are trying to hold you up and keep from falling on your face. That's why so many people have problems in their backs. It's not because there's anything wrong with their back, it's because every tissue is straining to keep us from falling flat on our noses. But that's what happens typically, is people focus on the pain in their back, the therapists or the doctors focus on the pain in the back, and that's where they go for treatment. But there's nothing wrong with the back, all right? It's all in how your body is dealing with gravity and the immense strain that is suffering just holding your head up. What ends up happening, as your head goes forward and starts getting projected in front of you, the natural response is that your lower back arches, and that pushes your hips forward, because when your back arches, your lower back arches, it brings your eyes back up. But that's just a simple response from your body. That's not the correct response. So as the back arches, pushes the hips forward, the knees go straight, the weight ends up in the toes. The weight jams right into the toes, and Dr. Glaser can tell you all the nice stuff that happens when your weight goes in your toes. All kinds of plantar fascial pain, Morton's neuroma, you name it. These are all posture and gravity related. And it all starts with your head, guys. When you add into that the whole idea of stress, which we go through all day long with work, with families, with responsibilities, these things, what they naturally do is they cause this fight or flight reaction in the body. Something's, I'm really ticked off, something's stressing me out today. And guess what that does? That causes the large muscles in the front of your body, like your abdominal muscles, your pectoral muscles, your leg muscles. Everything contracts to protect your organs. All right? So you basically go into what I call armadillo mode. Your body is trying to fold into a ball. All right? Everything's tucking forward. Now, if you combine that with what gravity is doing to you, every tissue in your body starts to constrict. You take away the space. You take away the space for blood flow, lymphatic flow, digestive juices, for nervous system signals. Everything gets crunched, just like putting a crimp on a hose. And what happens after that? Well, nothing moves. Okay? And the less you move, the more pain you got. Because the less you move, the less circulation there is, and you're already stressed for circulation as it is. So the worse your pain gets, the worse you feel. You start to get other symptoms in your body, digestive system, the clearness of the mind, pain in your knees, pain in your feet. You got it. It's all there. Healing becomes very difficult because of this. When things don't move, the tissues don't get the circulation of nutrition that they require. Your brain doesn't get the nutrition it requires. Your spinal column doesn't get the nutrition it requires. So what we do for that commonly is we take a lot of drugs. We are an overprescribed nation. All right, we have billions and billions of dollars that the pharmaceutical companies get to make giving us drugs, and they normally just cover up symptoms. They cause things like dependence. They cause side effects that actually make us worse, make us feel worse. A lot of patients with chronic pain will say, at this point, I don't know what makes me feel worse, the pain syndrome or the drugs that I take. You tell me. Surgery. Surgery is focused on the place that hurts. That place that actually hurts is very rarely where the problem is. The problem is in another place of the body, all related to posture and gravity and how you've been using your body over the years. Surgery is most of the time unsuccessful. I've read in different journals and studies that about 85% of the time, for instance, low back surgery does not have success. But it's sold constantly to patients as being the cure-all for herniated discs and nerve impingement and all this stuff. Typically, people have to go back for repeat visits of surgery. And this is one thing I noticed with people with CRPS is that they had more than one surgery. And usually after the second or third time is when their symptoms really started to kick up on them. Conventional physical therapy, I know a lot of really good PTs and OTs, and I'm not talking bad at all about them. Okay. What happens, though, is there's an over-reliance in physical therapy on modalities such as electrical stim and ultrasound, iontophoresis, these different types of things that, again, focus on where the pain is. All right. They also give a lot of exercises that don't treat the body as a whole. They just treat, oh, the knee hurts. Let's do a lot of extension with TheraBands with the knee. Let's do a lot of, hip extension, hip flexion movements, all right? But they don't treat the whole body. They just look at where it's hurting. And part of that is based on how the insurance system works. The insurance system does not, reimburse very well if a PT says, I'm treating another place that doesn't hurt the body. Okay. It requires a lot of visits. A lot of conditions require 20 to 40 visits of physical therapy, and this can be a daily occurrence for people. And it's expensive. If you don't have insurance, or if you have an insurance with a high deductible, PT is extremely expensive, and it can go on for a very long time. So what we do that's so different is we focus on the source of the problem, which is not where the pain is. It's on what the whole body's doing. We have to look at the way the body responds to stress, what elements are in the person's life that causes stress. We have to look at their diet. We have to look at how they're spending their time. Are they sitting a lot? Are they not stretching correctly? Are they spending a lot of time, standing in the same position? We have to find out what contributes to the discomfort they have. And when it comes to things like CRPS and RSD, we have to look at how is their day, how is their life, how is their week, month, whatever, how has it been wrapped around this disorder? Because chronic pain, any kind of pain in general, there's a huge psychological factor into it. It's not just physical. As a therapist, I think that 85% of what we do, 90% is psychology. And in treating people with chronic pain and CRPS, time and time again, that is a huge part of getting them to see the light beyond the dark that they experience with having chronic pain disorders. What we do is not rocket science, okay? It's not something that took 30 years of development in a university somewhere at MIT. What we do is we use manual ligament therapy to calm down the nervous system. This enables us to really have, from a base foundation, start to build on to the body. Okay, from there we can do things like start to mobilize the large muscles in the body, the abs, the chest, all these muscles that have constricted to produce that armadillo posture that we have. Get those to open up, get air flowing, get blood flowing again. And from there we have to re-educate the patient on how to move, how to stand, how to hold their weight in their body, putting their weight in their heels, which the orthotics are great for. So with all our patients, we put them in orthotics right off the bat from the first day. We get them casted and fit in for orthotics because they need all the help they can get to start taking that weight from their toes and way out in front of them to putting it back where it should be. Right? And also the education of being aware of how your body is moving and what it's doing. You can't just go through life just picking up your arm to grab things and walking around and running if you don't know really how you're supposed to move, and that what you're doing could be causing more problems. And what we find is probably the biggest tool is the education part of it. A lot of people talk about going to see a specialist or seeing a therapist and really just being told, okay, we don't know what's happening, but here, take this, go do this procedure, X, Y, Z. And I can't tell you how many times I've had a patient tell me, I don't feel like I understand what's going on with myself. And it's because they've never been told for whatever reason. Maybe because the person they've been seeing or the specialists that they have been seeing don't know, or maybe they're just not taking the time to explain to the person all the different things that impact them. So we talk to the people in the Gohl program, and we talk to them about what happens with different disorders and how the body reacts to it, just like we did in this webinar, just like we did in this presentation. What causes the body to contract? Get them knowing their body on a level they've never understood before. And that's completely empowering because it gives them that idea of, okay, now I know how my body works and what it does on a very basic level that's not full of mumbo jumbo and scientific words, and I'm given the tools of how to start dealing with myself and dealing with the things that I experience. And that is worth its weight in gold. And as we're going through treating these patients, we hear this time and time again. Thank you for letting us, telling me how I can take care of myself, empowering me with things, not just keeping me in the dark and shoving more treatments at me. So it's your body. You got to learn how to use it correctly. And it's something that we forgot to do a long time ago. And it's probably the most important thing. All right? So you do need a vacation from pain. Get in touch with us. We have a program for you that really does work. It really does help. You can see the testimonials. It's real. It's not just another shot in the dark that someone's promising results with. This is the real deal. It's education. It's treatment. It's a life-changing experience. And please give us a call, contact us, share your story with us. For information, you can go to gohlprogram.com. That's Gohl program.com. You can also find a station on YouTube, Gohl Program TV, and you can see the testimonials right there. And also testimonials from Haley herself, from CRPS patients from the first pilot study we did, and all the newest up-to-date patients that we're treating just right now, actually. So there's a lot of information on the website that reiterates what I talked about today. And I think it'll really give you a better idea of what we're up to and how we're doing things. And I hope that it makes you consider joining us. All right? Thanks, everybody.